Parade.
A Woman's Touch MD, some brand new procedures to talk about. We have two experts. One of them is a plastic surgeon, Dr. Julene Samuels of A Woman's Touch MD, and Cindy Lee, who is a registered nurse. Welcome to both of you. Okay, you and I had a chance a little bit, Dr. Samuels, to talk off camera, and we were talking about these new procedures. These are pretty exciting, and as much as I'm around medical experts, I have yet to hear of these. So would you consider this cutting edge technology?
Absolutely. We are actually the only ones in Kentucky right now to offer the UltraShape, which is one of the devices we're going to talk about. And the core is here, but not in a big way, and it follows some other innovations that we've introduced in the last 3 or 4 years.
Cindy Lee is with us, a registered nurse. And Cindy, now not only are you a registered nurse, but you're the recipient of a few of these procedures, is that correct?
Just a few.
All right. No, that's good. No, you look fantastic.
Thank you.
She's really 100, but she does.
You look great. You look great. So tell me a little bit about your experience at A Woman's Touch.
Well, I've been with Julene for 2 years now, I guess. I've had probably another 10 years of plastic surgery experience, so I come a little prepared. But she's offered lots and lots of different things. So I've had the core, which is a CO2 laser, and had that about 4 weeks ago. And then since then, 3 weeks ago, I guess we did the a little bit of the UltraShape. So I've had like one treatment of that, and then part of another treatment when we did an open house. So lost a little bit.
Good for you.
I'm happy.
Good. That's the main thing. If you are happy now, UltraShape. Tell me a little bit about this procedure. I have yet to hear about this.
Right. Well, actually, it's a device that's manufactured by Syneron Candela. They're a huge laser device manufacturer, and they have pioneered ultrasound technology now in a way that, although we've been very familiar with ultrasound in the past, both medically, diagnostically, and now in a treatment fashion, the cool thing about it is it's very safe, and it doesn't hurt if you process the energy correctly. But what they've done is it took years to get it through the FDA as well, because they were working on specific indications for volume reduction. So what you see on the slide here is a little depiction of how ultrasound works in the tissues, skin being at the top under the transducer. That cone of tissue that you see there is how the ultrasound energy is focused, and it's much like a magnifying glass. So when you pass through the skin comfortably, the patient actually doesn't feel anything. There's specifically no heat because it's pulsed. But when you get to the tip of that cone, about 1.5 centimeters below the skin surface is where the fat cells are basically destroyed. And within that treatment zone, about 30% of the fat cells are destroyed and then naturally eliminated by your body, much like with weight loss.
Okay. Now, is that the UltraShape? Now, what's the Vaser shape?
Vaser shape is ultrasound as well, but it's lightly focused, and it does involve heat as well as mechanical forces. Ultrasound is capable of doing what we call shake and bake, heat and mechanically affecting tissue. The heat does create a little skin tightening, and that can be a good thing. The lightly focused ultrasound effect does modify fat cells and make them leaky. So with UltraShape, we're destroying fat cells. With Vaser shape, we're making them leaky. Either way, you're eliminating fat cells, which are then processed by the body, and you get smaller. With Vaser shape, we use that for patients that have a little less thickness of the fat and also want skin tightening. Okay. The UltraShape is more effective in fewer treatments for true fat loss.
Okay, here's some before and after with the UltraShape, and I'm going to ask you, doctor, to do the play-by-play. Those are dramatic. That's a dramatic change right there. That's
which is the cool thing about UltraShape. We've had technology in the past that can reduce fat to some degree, but it takes too many treatments or it's painful. So what we've always been looking for is just, that turbo button where you could do fewer treatments, still be comfortable, and experience a measurable reduction of volume. So with UltraShape, these are 3 treatment results that are being shown, and on average, patients are losing 2 inches, some more, some less.
Wow.
of the fat thickness.
And that's not really, this is not considered an invasive procedure.
It's absolutely not invasive.
Wow, that's
right.
incredible.
No pain, no anesthesia, no incisions, no downtime. You start to see results also quicker than with other technologies, which might require 3 to 6 months to see results. This starts to happen within 2 weeks. Patients can feel smaller in their clothes, and we measure them before and after each treatment, so we track those results very scientifically. But it's just a really nice way to offer somebody something that is not surgical,
yes,
that easily fits into their lifestyle.
That achieves results. Okay,
right.
That was the ultra shape. Let's take a look at the Vaser shape and see some before and after there. Doctor, if you would again.
Now, with this patient, she does not have a real thick fat pad, but what you see on the back side is a lot of skin laxity, and actually you can see the folds of skin in that stubborn flank and bra fat area, we call it. And if you look at her after picture, that's just much tighter. She's a little pink because she just completed her treatment, and it is a heat that causes that collagen remodeling or skin tightening, but that pinkness goes away very quickly.
Mm-hmm.
This patient has a lot of stretch marks in the central abdomen from pregnancies, and she is achieving some fat reduction as well as the skin tightening. For patients that want maximal fat reduction and skin tightening, we'll begin our 1-hour ultra shape treatment with about 10 to 15 minutes of Vaser shape to tighten the skin, and then we proceed to the ultra shape for the maximal fat reduction that we can get.
Cindy Lee, when you talk to some of your patients afterwards, they have to be thrilled with these results.
They are.
Yeah, everybody's happy. That's nice.
Yeah.
That's a nice feeling, isn't it?
It is. It's very nice.
That has to be the rewarding part of being a plastic surgeon and something like this, and you go, wow, this, I've really made a difference in someone's life, made it more confident.
Right.
If nothing else.
And as a surgeon, we and surgical staff, we want immediate results. We're just like the patient. We're kind of impatient with having to do things too many times to achieve a meaningful change. So for us, it has to be pretty incredible non-invasive technology, or we're impatient as well.
All right, a woman's touch MD, a skillful, caring approach with a woman's touch. I like that tagline. It makes perfect sense. And real quickly, let's show you some of the specials up here. Okay, this is for Wave 3 Listens viewers. So call today or tomorrow and receive a complimentary consultation. It's absolutely free, and $500 off Ultra Shape package. You saw the results there. That's a great deal. And $250 off Vaser Shape package, and $250 off laser treatment. We didn't touch on the laser treatment in about 30 seconds. What can you tell me about that, Doc?
Well, again, we're looking for maximal results, less downtime. So what has become so in vogue are fractional treatments. So the patient can actually achieve skin smoothing and tightening, but with less downtime, which means redness.
And there's some before and after there. We have time to throw that in. That's a good-looking Cindy Lee. That's a pretty lady. Really great results, Cindy. You have to be happy with those results.
I'm very happy.
You look fabulous.
That was 4 weeks after.
Yeah.
Well, if you put you side by side with Cindy Crawford, I think you win that battle. I think you win. That looks great. Okay, again, a woman's touch MD, a skillful, caring approach with a woman's touch. That's important to you, isn't it?
It is.
A woman's touch. And what does that say to you? What's the difference?
Well, we have a boutique style practice. We are interested in getting to know our patients over time, so that's one of the reasons I've never concentrated my practice in one area. I like operating on patients over and over and offering them cutting edge technology. So we do face, breast, body, just pretty much everything cosmetic you'd ever want.
And there's the open house right there, Thursday, March 5th. Please attend and take advantage of some of those specials for Wave 3 Listens viewers only. We'll be right back on Wave 3 Listens.
Car wreck was serious.